Namaste and good afternoon to all of you. Today we are going to discuss with a very important disease called dementia. Dementia is a group of symptoms associated with neuron. It leads to develop various behavioral changes including loss of memory, sudden change in symptoms and behavior and its associated syndromes. Dementia generally, as a layman word, is called forgetfulness. Generally, when people become aged, they frequently start forgetting many things. This is a routine and usual process. But as far as disease phenomena is concerned, it is somewhat different compared to the normal forgetfulness. Suppose, let me give an example. Geriatric patient or the aged people frequently forget where they keep their keychain, but they never forget did they have their breakfast in the morning or not. But the dementia people will forget after some time what they did even half an hour back. So dementia is a neuro-related disorder. It is association of many disorders like Alzheimer disease, sometimes Parkinson's also. Now coming to the Alzheimer disease is a progressive neuro-degenerative disorder associated with dementia, means forgetfulness. As I have mentioned, it is a progressive disorder. So the onset of action to the death, generally it is estimated around 9 years. So slowly, day after day, the disease is in progressive state, and slowly it takes 8 to 9 years to show its fatality. Now what may be the reason for Alzheimer disease, or what are the etiologies of Alzheimer disease? Many researches throughout the world, across the world, has been conducted, and it has been observed that there are two pathological hallmarks associated with Alzheimer disease. First one is the formation of amyloid beta plaque, and second one is formation of neurofibrillary tangles inside neurons. One enzyme also plays a very vital role in the memory degeneration, that is acetylcholinesterase. Let us explain one by one these pathological hallmarks, how they create the disturbance among the signal transduction pathway of the neuron. As neuron is also considered like a normal cell, outer part and inner part of the cell, there is a protein called amyloid precursor protein. This amyloid precursor protein, as it is a protein, like other protein, the sequential phenomena is after delivering its routine function, it get denaturated or death occurs, and followed by it gets recycled. During this process, two enzymes takes part. First one is alpha secretase, followed by gamma secretase. So alpha and gamma secretase cleaves the amyloid precursor protein into soluble fragment. Till now, it is a normal process in all healthy human beings, and in fact animals also this phenomena occurs. Now there is another enzyme called beta secretase. This beta secretase, what it does, the soluble fraction what was developed due to the cleavage of alpha secretase, the tail part was cut down by beta secretase enzyme, and due to this fragmentation, this amyloid protein become insoluble, and slowly as the number increases, these insoluble amyloid proteins are sticky in nature and they club with each other and they form a plaque outside the neuron. So when this plaque forms outside the neuron, then the signal transduction pathway between two neurons are hampered. So the patient who suffers from Alzheimer disease may not receive the proper signal, and frequently they start forgetting what they did previously, maybe in a half an hour back or 1 hour back. Or they find extremely difficult to find their route to home, which they usually supposed to do few years back. Now coming to the another one, neurofibrillatory tangles. Neurofibrillatory tangles also form inside the neuronal cell by hyperphosphorylation of tau protein. Another protein is there called tau protein. Due to hyperphosphorylation of tau protein, these proteins get accumulated and they form a tangle like appearance, and these tangles along with the amyloid beta plaque, they slowly shrinkonize the neuron which is present inside the cortex region of the brain, and followed by neuronal death occurs. Due to this neuronal death, slowly various neurodegenerative symptoms as already I have mentioned, and behavioral changes also has been progressively shown in the Alzheimer's patient. And last one is the acetylcholinesterase enzyme. Acetylcholinesterase enzyme, actually it is present in all healthy human being when our journey starts in mother womb. Acetylcholine acetylcholine is a neurotransmitter, and this neurotransmitter plays a very vital role in memory formation. So this plays a vital role to recognize the voice of mother to the newborn, and to the voice of instrument which they loves to. And as there is an enzyme called acetylcholinesterase which is present inside the junction of the two neurons, and they causes the hydrolysis of this acetylcholine. When hydrolysis occurs, then the amount of acetylcholine level decreases further. Now in Alzheimer's patient, it has been observed that there is an elevated level of the acetylcholinesterase enzyme. Now already in Alzheimer's brain there is a declined state of acetylcholine level. If further hydrolysis occurs by the acetylcholinesterase enzyme, then it leads to further declining the amount of acetylcholine present in neuromuscular junction, and these may lead to several disturbances. So this is in brief various etiologies and the brief information regarding dementia and Alzheimer disease. So far it's okay. The remaining things I will explain in my next class. Thank you.